Great. So the recording is in progress. Folks, this is John Barry, and this is Wednesday, August 23rd. I got a little confused. We did update the agenda. We did that yesterday, which is why that date is up there in yellow on the screen for those of you who are online. With recording the meeting, I will just remind everyone that PHI stands for Protected Health Information. PII is Personally Identifying Information. We ask you to avoid PHI and PII, especially as this recording is now and has been for many months, quite a while, maybe a year, not sure, the means by which we have a record recording of the meeting. And so please, if I hear that happening, I will stop the action and ask people to be mindful of that. So it is Wednesday, the 23rd of August. We are here for the August meeting of the Participant Directed Programs Policy Collaborative, the PDPPC. And in terms of housekeeping, I will just say that in terms of taking comments and questions, we will be relying on people to jump into what we call the speakers queue. There may be a few new people. If you're not, bear with me. I will, at certain points in the meeting, I'll be monitoring the chat or the screen to see where which people are raising their hand, and I'm clicking mine so that, as an example, on the lower screen, if you have the meeting opened up full screen, it'll show raise hand. Otherwise, I believe it'll be in the reactions button. You can click on that and you can raise your hand. And then when you raise your hand, everyone will have 2 minutes to ask their question, make their point. And if you raise your hand once, you get to ask one question or make one comment. If you want to make others, you need to go back into the queue. And the reason for that is so that everybody in this generally large meeting can have the equal opportunity to speak, whether you're online, whether you're on the phone. And folks on the phone, I will also be asking at points for you to give me your name if you want to be in the speakers queue. I will stick to the agenda time-wise. We have 2 of our regular open forums. Those will be 10 minutes each. Anything we don't cover in the first one, I will roll over to the second one. We are taking a break today, 10 minutes at 2 p.m. And we will have the breakout rooms again. So let me ask folks who are not online, folks who are on the phone and not online, to give me your name for attendance.
Hello, this is Dolores Hurley.
Thank you, Dolores.
Oh, got me?
Ron and Tracy, how do I have you? There was someone else. I'm sorry. Who was that? I have Ron Heller, Tracy Heller, Dolores Hurley. Anyone else?
Renee Farmer.
Renee, thank you. Anyone else? This is just for folks on the phone. You'll see on the link for the attendance, and I will put it into the chat if one of the other staff doesn't beat me to it, to make sure it's in there. We have a hello from one of our co-chairs, Kurt Wolf, and I thought I saw Kevin earlier. I think they're both with us today. Anything else with housekeeping? We do have on page 2, which we do not need to scroll down, but every month for years, we've had the rules of engagement, if you will, that were developed by stakeholders. I would just ask folks, even when the issues are contentious, to please demonstrate courtesy for other people and to be aware that interrupting, loud talking, and talking with emotion, which is totally appropriate, but please be aware that some people are very sensitive around when things get tense and conflictual. We will have those things, but I'm asking you all just to handle them with decorum and courtesy for others. We have a very widely divergent group that attends these meetings. I will always call on stakeholders first, members, family members, advocates. And if later in the meeting I see someone who hasn't spoken yet, who's one of those people, I will bump them to the top of the line because we want to hear from as many different people as we can. So again, speakers queue, 2-minute limit. I will call names out, and thank you all very much for that. So I did the first 3 things, and I believe staff, if there's anything I missed, can certainly mention it. Okay, hearing none. So I will move us forward then to introduction of expanding self-direction by Julie Riskin. Julie, are you with us yet today?
I am, and I believe Shanda Hinton is also with
Oh.
us, I hope, who's
Oh,
going to
that's right. I forgot.
co-present.
There she is. You're both with us. Thank you. And
Okay.
your sound is coming through crystal clear. That's amazing. Great.
Great. Well, that's good. I've been having a not so great internet day, so hopefully it'll stay good.
Thank
Yeah,
you.
we are working on some expansion of consumer direction, but we wanted to kind of talk about what we're doing and why, and hear people's reactions, feedback, questions. So I wanted to start with talking about, because I'm old, so of why, and I was one of the people that was involved in creating this program to begin with, of running the legislation and really pushing this. So why did we do CDASS to begin with? Why do we even have this? Why? And it was really in response to problems that we had with home health agencies, where we had a lot of conflict on a regular basis of what time people, first of all, if they would serve someone, what time they were going to come. We had in rural areas, like there were times when like the only agency in town would say, well, we're going to close from like December 24th to January 1st. And like, that doesn't work, for people who need care every day. And we also had a lot of people just, being left in bed, and, we had people who had amputations, pressure sores, contractures that couldn't get fixed, all because of poor care, and just lack of access. And a lot of us in the disability community said, well, we could find our own people. We don't need them to be a CNA. We actually have to usually untrain them for that. And so we started with a pilot program. It was very successful. It was immediately too small and had to be expanded. It was very successful. It was studied, and then it became a permanent program, and then it moved to all of the other waivers. And we started, I think, just with EBD, and then it moved. So that's why we started CDASS. And we have, I think, whenever CDASS has been threatened, the community of clients have strongly defended it and talked about how great it was in their lives. We also have people, and I think our co-chair is one of those people, like Kurt, who came into CDASS after we'd already started it, who became disabled after we already started it. So never lived through the agency kind of horrors. And I'm not saying that agencies can never work for anyone. They just didn't tend to work for people with disabilities who had active lives, and they certainly didn't work for people who needed a lot of care. And they don't really work for people who have like high levels of care either, because they have to get trained, people with certifications, and we don't. So that's why we started it. But and when we expanded it to all waivers, we also, our intention was that it not just be 3 services, it not just be homemaker, personal care, and health maintenance, but that we look at the range of home and community-based services. And so when we were thinking about that, and we're going to talk about community first choice later, where that'll kind of come up more. But as we thought about, so which, again, if it were up to me as an advocate, I'd say all services. But if that isn't going to happen, then what are the services we should prioritize? And so we look at where are we having problems with access. And there's 4 service types that we have really identified as having access problems. One is the complementary and integrative health, which Shanda can talk more about in a minute, which is acupuncture, massage, and chiropractic. And Shanda and her crew did a great job of expanding. That was also a pilot, started as a pilot, very successful. And used to be just for spinal cord injured people in the metro area. It's now for anyone with a mobility condition statewide. The problem is, in some places like in Lamar, Colorado, a chiropractor is probably not going to enroll in Medicaid to serve possibly 2 or 3 people. And so in rural areas, they just don't have providers that are willing to do this, but they have those kind of providers, like they have chiropractors and massage people. They just need a way to pay them directly and not do it through Medicaid. Another area where we have a lot of problems is home modification. There are home modification. There, people who build ramps generally aren't seen as medical staff. So we need medical. So we need people to be able to just, maybe for all home mods, maybe for some, but a lot of home mods are simple. For example, putting in a grab bar is considered a home modification. Anyone can do that. Home modifications are really problematic because you have to do a bid, and the people who evaluate the bids don't always necessarily, they're not really construction experts either. And so we have home modifications often fail where a lot of money gets spent, and because the provider is not accountable to the client, they're accountable to some other entity. And so then the person's left with this disaster in their house, and then it sometimes costs a lot more money to fix it. And again, in rural areas, we have people that where there is no there's no one to do it. For example, on our tribal lands, there are people that build ramps. They are not willing to enroll. They don't want to enroll with Medicaid, and the tribes don't always let other providers on, even if they are up there. They have rules about who can and can't build stuff on their land. So consumer direction would work really well for that. Another area is non-medical transportation. And, even Accessoride has gone mostly to contracting with Uber and Lyft and on-demand service. But non-medical transportation, again, you don't have providers all over the state, but there has not been any kind of way to manage quality with non-medical transportation. So just letting people have a certain amount of money that, again, if they want to use Uber and Lyft in a taxi, great. Then they can do that. If they have a cheaper way, maybe there's someone that they can just pay to drive them, they could do that. They could just, again, figure it out for themselves. And then the final one is respite. Respite does not work but for people who have skilled needs. You can get home-based respite, but it's only through a personal care agency. And if you have any skilled needs, they will not accept you. So if you have to get in and out of bed using a Hoyer lift, you can't even use that. And then the only other option is respite in a nursing facility, which is not only a violation of Olmstead, but is not safe or appropriate. People come out of there with all kinds of problems, pressure sores, bowel impactions. And again, it's not appropriate for people to be in a nursing facility even for a week. So we thought those are places we could start. And our idea is that we start with those. You would do the budget the same way, like, well, what would you be paying for this using a traditional system? That's your allocation. And then you could have kind of add-ons or differences in training to teach people how to consumer direct those different services. So for example, with home modification, you would you could have someone train people on, like, how do you evaluate a bid, because that's something most people don't know. Or how do you talk to a contractor? If it's something like respite, it might be a different kind of set of questions, more like what we do with hiring caregivers. If it's for the alternative health providers, that would be a different kind of training of, how do you evaluate them? Are they licensed or certified anywhere, et cetera? But it could be like a module of CDASS training. And they would, if they were not using like home care services, they wouldn't have to take all of those, but they could still take the financial responsibility pieces. So that's like a really quick overview of what we're thinking. Shanda, do you want to add whatever I forgot?
No, I think that you summarized it very well. And I do believe, John, I don't know I know we have until like 1:24 to have this conversation. So I don't know if this is the form in which we'll collect feedback. I know that there's going to be a link to in which the department will send out to everyone about how they all want to be involved in what capacity. And so I know that that's going to be, so I think that there's going to be additional information in the September meeting, plus a particular inquiry link about how everyone from PDPPC want to be involved, and also in what particular segment of those you know, whether it's the non-medical transportation, respite, because everyone has, you know, a lot of experience or expertise in one over the other. And so that would be the only thing that I would add, Julie, on top of everything that you summarized. And I did put a lot of those bullet points in the chat as well, just in case those that might want to read it a little bit as Julie was speaking can have the ability to do that.
I think you sent them in the chat only to me.
I put them in the chat.
Yeah, but I think they went only to me.
Yes, and everyone, Chanda.
Okay, I'll send them out to everyone.
Okay, thanks.
Tanda, this is John Barry. Hi, and thanks to both of you. I do understand, my understanding was that this was an introduction and there would be some period of time of collecting feedback, as you said. So just to,
Yeah, so
that was my understanding.
yeah, so we're open with the few minutes we have for, I see, for questions or comments, or, you know, like, this is a good idea, this is a horrible idea, whatever people want. So.
Super, Julie. I'll, let's see. Kurt Wolf, stakeholder, go ahead, and then we'll get to Robin and then Danny. Kurt?
Real quickly, I actually had the unfortunate opportunity to get home health care before I got on CDASS.
Oh, you did? Okay.
Yeah, I had a caregiver, I had someone call it and say, we can't help you today, it's Wednesday, how about if we come Friday instead? It's like, okay, I'm stuck in bed, I guess, until Friday. But that was a big impetus for me to get onto CDASS and why I want to be so involved in this, number one. So, and then John, I just want to mention that we have talked about expanding CDASS for some time. So let's make sure that we include that with our planning call moving forward next month, so we can have more time on how we address this. If we need to do this as a formal proposal, let's be prepared for that maybe, all right?
Sure, we'll talk about it with you at the call.
Good.
We'll all talk together, I should say, yeah.
Yeah.
Okay, thank you. And I forgot to mention the time thing. I apologize. I'm trying to be consistent. So Robin Bolduc, welcome back to the meeting, and you got 2 minutes. Thanks.
Oh, thank you. My question is this a good time while we're doing consumer direction to expand housing modification, our definition of housing modifications? My question being, you know, we have limited funds to do shelter in place, and given what's going on in the state at the moment, so things like backup batteries, I believe, should be covered under housing modifications. And for some folks, air conditioning should be covered. Again, we're looking at whether you agree with me or not on climate change that impacts on how we live and what certain populations need in order to stay home. Nursing homes require generators and air conditioning, so why shouldn't that be under home modifications for people who live in their own home? Stayed under 2 minutes.
Thank you, Robin. Well under, thank you. Danny, you're up next, and Julie and Chanda just point out there's a comment question from a stakeholder. It seems like it's to you in the chat. Danny, go ahead.
John, and thanks Julie and Chanda for just introducing this topic. It's really exciting to think about the ways that we can expand self-direction, and I think it's also important for us to identify maybe some of the pain points we have in services and how self-direction might be helpful. And I think I'll just provide a little bit more clarification about what's going on with this project as it relates to HICPA. But right now we're very much in the research. We're working with an external vendor to conduct some research to figure out, one, is this possible? Two, if this is possible, how is it possible? Is it, you know, its own service or things of that nature? And as far as ongoing stakeholder engagement, I know that this team, Chanda, Julie, and also HICPA is also very excited to continue stakeholder engagement with this. I think we will be having some more information about how you can involve at next month's PDPPC. We'll be providing I believe we'll be sharing an interest form with the group. So then you can let us know what level of engagement you would like to participate in if this is something you're interested in. But that's just a little bit of clarification. Hopefully that's helpful.
Thank you, Danny. And Danny, just a little feedback. We're breaking up slightly with the audio. Maybe if you just speak up or something next time, but you came through. Chanda, you're up next. You have 2 minutes.
Yeah, I just want to, reiterate that I think we wanted to bring this to the PDPPC just because it's appropriate that it does come to you all, given, it's participant directed programs, policy collaborative. And so that just is very clear that this information needed to come to you guys. And I think that if there's a formal support that you all that PDPPC wants to give to the department, I think that's always beneficial. And then I'm also going to say that wondering at what capacity we can share, Danny, some of the overview and timeline in September of the vendors kind of, particular pieces from a high level. So that would be my only request for September.
Yeah, Chanda, can you hear me okay now? Is that better? Okay. Chanda, great questions. I think the timeline and next steps are still actively in motion. So before next September, before the meeting in September, we can connect and get a good plan in place for how to best engage this group.
Okay, thanks, everybody. We have 2 minutes or a little bit under probably, but any other comments, questions for anyone? Julie, Chanda, Hickpuff on this topic? We have, looks like one hand raised. Maureen Welch, go ahead, please. You have 2 minutes. Thank you.
I actually put my comments in the chat. Can you hear me okay?
Yes.
Okay, great. So I just, thanks for the update. I'm just kind of jumping in to learn more here. We do have some services in the kids in the DD waivers that would benefit from additional self-direction. And I know that you have respite in the list that Chanda put in there, and I imagine that's the one that you're targeting for the first expansion. But we do have some services that are respite-ish, or should I say they serve the same intent as respite, and they don't have as many caps. We have a lot of caps on respite expenditure in those waivers. And that's DayHab, which is a one-on-one called Supported Community Connection. And then we also have youth day services, which is sort of a childcare service for 12 to 17-year-olds, which is basically respite for work hours. And then also Community Connector. And those are all giving breaks to the primary caregiver while letting the client grow in their skills. And I'd really like to see those on the, what I want to say, priority list, because they are used a lot in our community more than respite. And often they pay more than respite. So we can actually attract a caregiver. So those are the ones that a lot of us use.
Maureen, you have 15 seconds. Thank you.
All right. Thank you so much.
We have a bit of a minute left, and I don't know if Cassie Keller, you wanted to say anything, but if so, we can give you the floor. Okay, perhaps Cassandra already left.
Oh, John, all I had put in the chat is we do have a grant program. I know that is not the same as including air conditioners and backup power supplies into the home modification benefit, but currently there's a grant program that offers backup power supplies to members who qualify, who use life sustaining devices. So I just put that information and the link to that application in the chat.
Thank you. Very good. Thanks a lot. Okay, it is time for our open forum. And so I'm calling for names. You can raise your hand in the webinar to put your name in the queue for the open forum. It is a 10-minute period for announcements, for questions, although we don't get into a back and forth generally, and for any sort of community connection. This is a community. that you may want to make with other stakeholders? We have one so far. Anyone else? Okay, I will go to Julie and then check in again about more names. Julie, thanks.
Yes, I just wanted to let people know that the Colorado Cross Disability Coalition is doing listening tours around the state. We've been in Lamar, Pueblo, and Colorado Springs already, and in a couple of weeks, we'll be going to the West Slope, going to Grand Junction, Montrose, Glenwood, Craig, and Eagle. The Eagle one will be in Spanish. We'll also be later in the month in Greeley and Fort Collins, and then in the Four Corners in early October. And we will have several, two virtuals in English, two in Spanish, and one in ASL. So check out if anyone wants to be invited. I think it'll be on our it should be on our website. And if you're a member, you'll be getting invitations to these. So I just wanted to let people know a big focus is on Medicaid, not just long-term care, but all of Medicaid. But we're talking about other things and mostly listening to people about what they want to see from our organization. We know that there are people who were disappointed that we did not get to their community. We're going to start doing these every year and not go to the same community 2 years in a row so that we can get to more communities in person.
Okay, thank you, Julie. Next up is Kurt. Kurt, you have 2 minutes, sir. Thanks.
Sure. I just thought I'd take the opportunity to mention that we've given a lot of thought moving forward. I haven't really got to talk to Kevin about this, but really for me personally, I was looking that we could maybe get someone be interested in being at least a backup in training co-chair moving forward. So we could maybe have some secession down the road. But like, it's awesome doing this stuff. I like to do it and hopefully it lasts forever, but it'd be nice to have maybe someone as a backup down the road, basically thinking a little bit what happened to me earlier this year. So if anyone's interested in wanting to step up, definitely reach out to us and feel like you can be maybe someone co-chair in training. Just thought I'd throw that out there as an announcement.
Thank you, Kurt. Next up is Robin Bolduc. Robin, you have 2 minutes. Thanks.
Yeah, I can't see on the agenda. Maybe it's there. Can we have, there's two issues that are putting people in danger of losing their services. One is the renewal process for long-term care. Counties are backlogged, and I know they've been given an extra 60 days, but folks are losing services without notice, and reinstating those services has been difficult. How's that? And the other is Teligent's been going past the renewal date in either denying or changing or approving care plans, which means that there's issues with, it's August 1st and Teligent hasn't approved the care plan, and now people can't clock in and clock out. So I guess what I'm asking is, if it's not on the agenda, could we put it on the agenda? Or if if HCPF can respond on as advocates, how can we advocate for folks going through this, and what's their plan to stop it from happening? That's it.
Thank you, Robin. Okay, next up is Chanda. Thanks, Chanda. You have 2 minutes.
Thanks, John. It's Chanda. I just wanted to share that there are a lot of conversations happening between the ACC .3 kind of transitioning into that new phase, as well as there was a town hall meeting yesterday with, HCPF in terms of the health equity plans that are being developed by providers. And so the department's doing a lot of work, as I think a lot of advocates have been coming forward to indicate that disability competent healthcare as it relates to Medicaid providers, there's a lack of compliance when it comes to various pieces of people being able to access those services. The Chanda Center and some other advocate organizations, I know Julie in CCDC, Disability Law Colorado, and some other folks are definitely supportive. We're kind of strategizing other components separate from the department, but we really need to ensure that the stories and the information needed to really allow the department to understand that there's quite a bit of disparity as a result of lack of disability competent. So be aware of these meetings that are going to be sent out either through John, but it's around disability competence or health equity. And please come and communicate your barriers to accessing just general primary care physicians and other healthcare services.
Thank you, Chanda. Folks, this is John. We have time for one more, I believe, during this open forum period, which will be up to 2 minutes. Anyone, any other names for the queue here? You can raise your hand in the webinar. If you're on the phone, you can unmute, *6, give me your name. If you're on the phone only, I mean. Okay, hearing none, seeing none. Thank you all. We will have another open forum later in the meeting. We are approximately 5 or 6 minutes, 6 something ahead of schedule, which we may need. The next item up is Community First Choice, otherwise known as CFC updates.
Thanks, John. Hi, everyone. This is Christine Dos Santos with the department. I'm here to give you just a brief update on this past month and a peek into what we'll be doing at our next council meeting. Over the past month, the CFC team has been working hard, working on the wellness education benefit or WEB benefit, putting some rule language together and getting that through our clearance chain. Additionally, we've been working on some benefit work around transition services. And then next month on September 6th, from 10 to 11:30, we will be having our next council meeting. We will be discussing how CFC will impact our SLS members. And if you would like to join, you can find links to this meeting on the Office of Community Living OCL stakeholder engagement calendar. And that is all I have. I'm more than welcome to take some questions though, if anyone has any.
Folks, if you do, this is John. You can raise your hand in the webinar. Let us know you're interested, asking a question, making a comment. Anyone? Community First Choice? Okay, looks like you covered it so well. We have absolutely nothing, Christine. Thank you. All right, see you next month. Next up, Jessica Corral requests for proposal. I'm having a little trouble talking today. RFP updates. Jessica.
Thanks, John. Hi, everyone. Jessica Corral here, contract specialist for participant-directed programs. I wanted to provide some updates on where we are at with the 2 requests for proposals that we have. As a reminder, we're going out for solicitation for our FMS contracts, as well as training and support contract. The RFPs are in the final stages of clearance with department leadership, and so we anticipate they will be posted to the state solicitation website for contractor bids and public view in early September. During the posting period, the contracts and procurement team will be responsible for addressing any questions or comments about the documents or the process. As far as the evaluation committee is concerned, we're going to be using a standard process. Generally, HCPUF prohibits any person with bias for or against, or even perceived bias toward any bidding contractors from being on the committee. The committee approach that we're taking is to have HCPUF staff participate, and they're going to be provided very specific evaluation guidelines that are dictated by our procurement office. We're taking this approach for our RFPs really to reduce the risk of a failed procurement. This can happen from time to time, especially if guidelines are not followed. And in our world of participant direction, this would be extremely detrimental to members and have quite impactful ripple effects, we think. So we're trying to avoid that. I want to be really clear and share with you all that stakeholder feedback was requested and reviewed and really used to create these RFPs. We had dedicated RFP listening sessions, an FMS survey, and this space has consistently been communicated as a forum to provide comments and questions that we are always open to. Moreover, we've been collecting feedback from you all from the various channels, whether it be phone calls or emails or our issue report form for the past 3 years. And so all of that was reviewed as well and taken into consideration with those RFP documents. So really, we want you to know that your voices have been heard. We understand and really agree with the importance of improved customer service, supports and resources being improved and expanded, technology being improved and expanded, and really direct engagement with participants being important for our contractors to engage in. Lastly, I'll just share that we are hoping to pull together a startup committee, which would include stakeholders, and this would be the onboarding of any new contractors that we have. And we really hope that interested stakeholders who would like to participate in that process, let us know so we can include you in the planning of that. More details to come, especially when the RFPs are posted. And that's all I have, John. Thank you.
Thank you, Jessica. So we have a few minutes. If there is anyone who has a question or comment, due to procurement policies, which I'm not an expert on, but I know enough that we, with some questions, may need to defer based on those rules, but we have one in the queue so far. Anyone else? So I can budget the time. No other comments, questions. Okay, Julie, thank you. You have 2 minutes, please. Thank you.
Yeah, thanks. I agree that you absolutely don't want a failed procurement. I don't think that, and I think that having people with known bias on the committee would be totally inappropriate for a variety of reasons. I don't think having like real and meaningful involvement, though, I don't think that's mutually exclusive. And I just want to apologize to the community because in talking about case management redesign, I in my role as an advocate, agreed to a different, like to use kind of surveys to get stakeholder involvement, because doing the amount of time to be on that committee to do that, and with 20 different bid areas, and finding people that had the time, the expertise, and were non-conflicted was going to be impossible. So I kind of agreed to give the department some grace and to say like, okay, let's try this. I had no idea that without any discussion, it was going to become the way they do things. I will never again be that cooperative. And I apologize to the community for my lapse in judgment.
Okay, thank you, Julie. Any other comments, questions? We have about a minute left here. Looking for hands raised in the webinar. Seeing none. Okay, we will move forward. And Kurt Wolf, you are up, sir.
Sure.
Overspending protocol discussion.
We'll start out with I missed the meeting when Kristen, I believe, had a pretty good presentation regarding overspending protocol. But I will speak to the fact that from what I understand, and maybe Kevin, if you can jump in and help me with this, I'd appreciate it, is there are going to be times when occasion, especially if there's a high need, that the 30% limit that was imposed here quite a few years ago back, may be something that has to be taken in consideration based on a certain circumstances. So the situation right now as it stands is the rule goes that no matter what, even if monies are left in reserve, that monies will not be paid out in excess of 130% of the monthly allocation. So as a very specific example, if your allocation is $1,000, 10% of that would be $100, and 30% of that would be $300. So if your total allocation was 1,000, you would never be paid out more than 1,300 in 1 month, even if you had an extra $400 or $500 in reserve. Depending on that need, that's not a whole lot of extra overspending. And so I think we need to consider a way to put in writing where we can propose circumstances where it would be necessary and viable to use those monies, especially if they've been saved up for those times when there's for example, a trip. It might be a little personal example. When I travel, I have to have a Hoyer lift. I have someone with me. I have a lot more care that maybe need than a normal person. So I have to save up a lot of time and really budget my time where I am at, so I don't go over that 130%. So that's kind of what we've been talking about. Is Kristen here by chance? Can you speak more to that? I see your name is on here. And I know we do have to be patient with you, Kristen. I'm more than happy to listen. I think I actually did a training with you.
Kurt, this is John. I do not see Kristen on the attendance list for the webinar today.
Okay.
Christine Dos Santos, maybe that's who you saw, but
I do. It's Christine. I'm sorry. Kevin Smith, are you there? Can you talk to this a little bit more?
It's Kevin. I'm here. I really don't have any background or any info to add to this. I do remember the presentation, but being on the IHSS agency side, we don't deal with that sort of thing.
Okay. So I would like to open the floor up for further comments on that, because I would like to move forward with at least putting a proposal together on that. I think it's warranted. And something we consider, of course, I think part of the idea is that there was some pretty big allocations, and then I'll just put it out there that a lot of people felt there was a use it or lose it. So there was a max, because you weren't really giving back dollars, you were really giving back time. And the idea that you ask for additional time, whether it be accompanied or things such as that, where you would not maybe need that time. So, but there are times when you do need it, and it's kind of crop up all at one time, whether it's like I said, a long vacation, or whether it's an event or something that's going on that requires that extra time needed in a particular month. Looking for more feedback on that with anyone who could help me with how we would maybe do that as a written proposal. And John, I'm sorry, I looked for the email you sent me regarding Kristen's proposal, but I'm not seeing it in my email anywhere. It might have been in my trash or junk. So if you could send that again, I'd appreciate it.
I sure will, Kurt. Folks, this is John. I'll do the cue thing here. If there's anyone who has a response for Kurt around this topic, question, comment, you can raise your hand in the webinar. Seeing none, Kurt, let me just, you asked me before about Kristen and you were looking for her in the meeting. So I just want to say to you that, and to me, this is part of how something that informs this process this time around with this perhaps written recommendation, if stakeholders go there, and that is that Kristen is unable to speak out loud. She had a computer voice reading out the document that I sent to you, and I will send you again. So in terms of interacting with her, just want you to know that this is a bit of a different situation, but however, one that we're totally technically, we can handle it and help stakeholders to interact with her as need be. So any comments, any questions for Kurt? Chanda, please go ahead. Thank you. You have 2 minutes.
Thank you, John. It's Chanda Hinton. Kurt, so is there going to be a formal recommendation as it relates to this, knowing that what Kristen presented as the last was very She gave a lot of examples. I mean, I've heard of a lot of our participants that have also ran into that very same thing where they, saved up a lot of money to go somewhere, but then they didn't realize by utilizing all those dollars, particularly in one particular month, then it was over that ability. So I'm curious is there a formal proposal from PDPPC to the department as it relates to how this is going to change or not change for the future? Or are you just saying?
No, actually, I think that's where we're at the point of discussing moving forward with a formal proposal that Kristen, I believe, was requesting by us. So what I was really hoping to do is, I think at this time, John, do we say we move forward with having a vote to present a formal proposal and then have it drafted up so we can approve it at the next meeting. But yes, so I think that is how we want to move forward, is a formal proposal on it.
Kurt, this is John. I'm not quite sure what you asked, but if this is what you asked, then I would respond, and I may have it wrong. Written recommendations in the past, we've had about 14 or 15 over the years from this group, have required a vote, but to conduct a vote on whether to draft up, a recommendation has not been done and is not required. If stakeholders want to do that, I guess they can.
John, I think that's the idea, and I'll draft something up. I believe I have the format for that, and I will present it and for more discussion at the next meeting before we move forward with spreading it to the department.
Yep.
Thanks,
I thought I saw Oliver unmute himself. Oliver, did you want to speak? Nope.
No, it was an accident. Sorry.
No problem, sir. Did you say you saw someone's hand up, Kurt? Oops. No.
No, I haven't seen any of their hands up.
Okay. Is that all for now then, Kurt?
That's all I have for now. I'll
All
get
right.
something written up for the group unless there's any other discussion.
Any other discussion on this? I'm remembering back now to the presentation, Kurt, and I'll just say that there were 3 people, believe it was Chanda, believe it was Oliver, believe it was Jerry Froney, who commented to support this at the time that Kristen was in the meeting and gave that. So, okay. Thank you, everybody. We are about 10 minutes ahead of schedule. So I think that I will call a break now because I want to keep the breakout rooms, and I hope everyone will understand that we want to sort of keep them within 10 minutes of when they're scheduled, because there are stakeholders who come in and count on them starting around the time that they do. So I think if we start them at 2 p.m., that would be reasonable. Kevin and Kurt, if you disagree.
Oh, sounds good.
Yeah, so let me call break now. We will reconvene at 2 p.m. and begin the breakout rooms. So everyone, we'll see you back at 2 o'clock. Thank you.
las leyes.
Okay, everybody, this is John Barry again. Welcome back to the second part of our PDPPC meeting for today, August 23rd. Reminder that we are still recording. And by the way, for those who don't know, I do send out the links to the recordings when we get them. They are also posted on our PDPPC webpage. And I will, just for reference, post a link for those who are not familiar with it to that page in the chat once we get the breakout rooms going. So thank you very much. And let's see, Jessica, are you with us?
Yep, I'm here.
All righty.
So we'll go ahead and open all the rooms. If anyone needs assistance with finding the menu for the breakout rooms or getting into one, hang back and John can help you. And then of course, those of you calling in will need to let John know which room you'd like to go into.
Okay, folks, I'm still here. Jessica is in one of the rooms. And if you are having trouble getting into a room, not sure how to do it, I'm seeing, Ron, your phone number. I'm going to send you to the members only group. Anyone else who needs help?
Renee,
Renee, last three digits again, is it 3, 6?
762.
Darn it, I had a 50-50 chance there.
Oh, yeah.
Anyone else? The members room, by the way, is sort of members, family members, advocates, that sort of community. The other rooms are FMS, which is, of course, having anything to do with the financial management service agencies, training, case management, so on, vendors, basically. IHSS, of course, in-home support services, those issues. Anyone else need help getting into a room?
Yes. Dolores.
Dolores, thank you.
Dolores, I would like to go into breakout room number 2.
Okay, is it 364? Is that your last three digits, Dolores?
Yes.
Okay, room number, let's see, which one was that? IHSS? Members only? Dolores?
Yes.
Which room was it, members?
Oh, I'm sorry. Breakout room number 2.
Okay, which is the IHSS, I believe.
That is correct.
Okay. Anyone else? Hello?
Hey, John.
Yes, sir.
John, it's Ron. Hello.
Okay.
When you were talking to me, I got interrupted by someone on the phone. So I don't know what you said, actually.
Well, do you want to go into one of the breakout rooms, Ron?
Yeah.
Okay, which one? Members?
Yes. Number 1.
Okay, I think there we go, sir. Anyone else? I see Nathan here. Nathan, are you with us? Okay. Well, folks, if you are hearing me, I am standing by to help people get into a breakout room. Just let me know.
Hey, John, this is Nathan. Can you send me into the usual room?
Okay, Nathan, the one for the usual suspects. That's
Yep.
got it, bud. Take care, man.
Thanks.
Okay,
Hi, could you send me to the members only room?
okay, is this Clarice?
Yes,
All right,
thank you.
yep. Anyone else?
I think the send failed.
Well, boy, let's see. I don't see you on the list of people who are not assigned. I'm looking in the members and it says you're not.
wonder-
Did you click accept?
I thought I did. My little window, I'm unusually on my phone today.
Okay,
And I saw a left window that looked like it said, no, don't join. And so I presume the one on the right was join. So I clicked that one. Maybe I clicked the
Oh.
wrong one.
I see you.
And maybe there's this little cloud with an arrow pointing to the right. Maybe I need to click that.
Yes, try that, Nathan.
Okay.
There we are.
Hey,
All right.
John, could you send me to the members group? This is Kurt.
Yes, sure will. Okay.
for caregivers, not CDASS.
The rate setting is what, Danny, that Adam's talking about? That was so close.
Just say that the rate setting is related to payment for caregivers directly and not the rate set at the HCPF level for CDASS services. So just wanted to clarify that piece of it.
Hey, it looks like we have everyone back, folks. Thank you. And we are moving to item number 10 on our agenda. So no, item number 11, that's why the time was off. I thought we were way behind. I thought we had been ahead. Subcommittees and work groups report out. We talked about expanding CDASS before. Staff team, I believe, had covered it. Is that good?
Yes, John,
Yeah,
I think
John,
we can.
Okie doke.
Go ahead, Beth.
We do not have a URUM utilization review, utilization management report until October, looks like. IHSS subcommittee report.
Hello, this is Emily Harvey. I oversee the in-home support services, homemaker personal care, and pediatric personal care benefits. And I'm here to provide the IHSS subcommittee report out. We just had our meeting in our breakout room. That is where we conduct our updates as a service delivery option here through PDPPC. And so we just went over some information about complex solutions. I gave a statistic update on number of members and number of agencies. And we also talked about non-IHSS state plan benefit of pediatric personal care as well to start some conversations. And then people were able to have some open time to ask some specific questions that might have been burning on their minds. So we were able to have some really good conversation and we're able to get some next steps on some fun projects. So I look forward to updating PDPPC as those move along. And that was about it. And we also do not have an NCAPS update until October either. So that is my report. Thanks, John.
Thank you, Emily. Any questions about that for anyone not in the meeting? Anything? You can raise your hand in the webinar to put your name in the queue for that. Nope. Very good. And the next NCAPS report will be in October, and each month I fail to remember what that means. The National Committee for Person-Centered Person Services.
I'll jump in, John. It's the.
Thank you, Jessica.
I don't know why I'm jumping in. You take it, Emily.
It's all right. I think it's all a group effort here. So it's the National Center on Advancing Person-Centered Practices and Systems. And John, don't feel bad. I pull up their website every single month.
Okay, thank you. All right. We are now at the open forum number 2. Reminder, this is announcements, requests, people networking with each other within this community to ask questions, make connections, etc. So do we have any hands? We have one so far. Robin, we'll get to you. Anyone else? If you are on the phone only, you can put your name into the queue by pressing *6, unmuting your phone. I believe in Zoom, you can also press *9 to raise your hand in the webinar. It will achieve the same effect. Anyone else? Okay, I'll check back in about that. Robin Bolduck, please go ahead. You have 2 minutes. Thanks, Robin.
Okay, it'll be quick. I'm really concerned about what's going on with the FMS and the RFPs, and I don't know where we are. I probably missed half that conversation. but it sounds like you're not including people who use CDASS in the FMS selection process, which is totally new. I've been on that selection committee multiple times. My concern is, and my experience is that other non-participants don't always understand CDASS. And decisions are made that are harmful to the program if there's no one there that lives the program. And I'd like to remind you, it's consumer directed. It's not consumer directed if policymakers make all the decisions. This committee was formed because we wanted to have direction and direct policymakers on what people who live the program need and desire. And that's why our program is so good. And anyone sitting on NCLEX knows it's a hugely different than what other states are doing when policymakers make decisions about consumer direction. It's just, I guess it's crazy making to call something consumer direction and not include consumers in policy decisions. And every single person that works within CDASS, whether at the policy level or as a direct consumer, has experience with people or with agencies that are going to apply. So, I mean, that would negate, you know, anybody sitting on this committee and call today from being part of the FMS selection. And then ending with, never forget nothing about us without us. Never forget that. And that should be what you should be thinking when you make these decisions. And if that's the conclusion you came from, then you don't get this. That's it.
Thank you very much, Robin. Anyone else who has a comment, question? Okay, Kurt Wolf, thank you. Go ahead. You have 2 minutes.
So first, I'll just ditto everything Robin said. I was thinking about, John, mine more of a question, administratively wise. It appears that the breakout rooms are being recorded and transcripts are still being recorded through Zoom. Is that correct?
If I may, I will refer that question to Jessica. I'm actually not tuned into that. I don't know. Jessica, not to put you on the spot, is that correct?
Apologies. Can you restate the question, Kurt?
Sure. When I signed into the members only group, it also said the recording was being recorded and transcripts were being made available through Zoom. I'm just wondering if that's the case for the breakout rooms or not, and if it should be.
It shouldn't be. The Zoom functionality, as we understand it, does not continue the recording in each of the breakout rooms. So I don't know why there would have been that message, but I'll take that back to our IT person to see what that's about. And if it did happen to include conversations for the breakout rooms in the recording, just know that we always review the recording before it gets posted. So in this case, we can remove any of that dialogue or transcript that was recorded before anything gets posted.
Okay, I just want to make sure everyone feels that they can speak
It shouldn't
freely
be.
in all those meetings. Okay. Thank you, Jessica.
Thanks, Kurt. This is John again. And I will just say, Kurt, in the time that we've had the breakout rooms, which is, I lose track of time, a year or so or thereabouts, I've never seen a recording, certainly not part of the larger meeting recording that we post online, since they are concurrent. But we'll look into it, as Jessica said. Anyone else? Open forum number 2, the final open forum for today and the final agenda item. Robin, please go ahead. 2 minutes, thank you.
Yeah, just a comment, Jessica, if you're reviewing the recordings and the recording what we're saying in our breakout room, then you're right. I mean, sometimes there's unpleasant things said about HIPAA and you know, I mean, today about the
the not being part of the FMS, we weren't very complimentary. So that is not something we want shared with you,
Understood, Robin.
not you personally, but HICPUF.
Fair, yeah, and that space was created specifically for you guys to have the ability to have open dialogue, whatever that may look like. Up until now, the breakout room discussions have not been part of the recording, so that's why I said it shouldn't be happening. It hasn't been happening, and I don't know why that message popped up on Kurt's screen. I didn't see that, so rest assured, and from the day we started the breakout rooms until now, we've not seen recording or transcript of the dialogue in those rooms. But I do want to double check this just to be extra sure from today's session.
Oh, thanks.
Okay, thank you, Robin. Kurt, I see your hand up. I think I failed to put it down before, but if you raised it again, certainly you can speak.
You did raise it a thing again. Just because I got random thoughts going through my head here regarding various subjects. One is recently I've been talking to people regarding rates of pay for caregivers, and I don't know that process of giving raises. I know all of a sudden we get one with the state, and I know it has to do with the long spill, and certainly Julie and others know about it. But with the rate increases coming up, I know Denver's went from 1729 going up 1829 the first of the year again, and at 1575 at the state based on the monthly allocation. I think there needs to be a review more up to date with what we need to pay carers in order to maintain and retain them. So I just want to throw that out to the open forum for everyone to say, we need to start figuring out how we're going to get some real increases for the allocation so we can pay our caregivers more. Just thought I'd mention that. Right now, I think it works out to where if you're on personal care and home health care, you can probably afford about maybe $18 an hour. And I'm sorry, people are getting hired at McDonald's for more than 18 bucks an hour throughout the city. So just throwing that out there as a comment.
Thank you, Kurt. Anyone else for the open forum? Okay. Well, let me review. This is August, and the next meeting is the 4th Wednesday in September. We started 1. We may not go till 4. Lately, we've been having meetings shorter than 3 hours, but please block out 3 hours for now. And if you didn't fill out the attendance link, please do so we can capture your attendance. If you ever have problems with that, you can always email me, John Berry. My email is sort of plastered all over the place. So with that, I will wrap up the meeting, and we will see you, talk to you next month. Everybody, I hope you have a great Labor Day holiday and safe and healthy, and take care. Thanks, everybody.
Bye, everyone.